Let's talk about etiology in Chinese medicine. We will focus on dampness. Dampness is a dominant climatic pathogenic factor of late summer. The period of transition from summer to autumn is the wettest season of the year in eastern China. Illnesses of dampness also fall in two broad groups: exogenous and endogenous dampness illnesses. Exogenous dampness illnesses usually result from very damp climate, exposure to rain or water, or a damp residence. Endogenous dampness illnesses arise when the spleen's transforming function is weak, so that dampness accumulates. Although these two types of dampness differ, they often affect each other in the course of illnesses. So here we can see the nature and pathogenic characteristics of dampness. So dampness disturbs the functional qi. So this will result in aversion to cold, fever, sensation of heaviness in the head and body. Dampness evil also injures yang qi. This will cause failure of the spleen in transportation and transformation, leading to diarrhea, scanty urine, edema, and ascites. Dampness evil can cause heaviness and turbidity, and also band-like squeezing headache and numb skin and muscles and arthrodenia. And dampness evil can also lead to stiffness and stagnation. And the patient will be feeling heavy and tired all over the body, sluggish or heavy turbid urine, liquid stools, vaginal discharge. So this is actually a pathogen that can cause both chemical and physical irritation. And for internal dampness, this is the result of failure of the spleen in transporting and transforming functions. So this is what we call interior dampness. So with interior dampness, there is retention of the interior water dampness in the upper jaw, middle jaw, and in the lower jaw. Dampness is a yin evil and tends to obstruct qi movement and consume yang qi. Dampness is heavy and turbid, and its nature resembles that of water. When it invades the body, it tends to settle in the Zangfu viscera and their meridians, where it readily impedes the movement of qi. This inhibits the free ascent and descent of qi and blocks the meridians, producing such symptoms as chest tightness, gastric distension, scant urine with dysuria, and difficulty with defecation. Because dampness is a yin evil, when it invades the body, it readily injures yang qi. Exogenous dampness often accumulates in the body, and the spleen tends to be the first organ it damages, so that spleen yang cannot be aroused and its transportation and transformation functions ineffective. The stagnated dampness accumulates and can lead to diarrhea, oliguria, edema, and ascites. The dampness evil is heavy and turbid. Heavy means that a patient with an exogenous dampness illness often has a headache that is like the head being bound tightly, heaviness and tiredness in the entire body, and aches and heaviness in the limbs. Turbid generally means that the secretions are not clear. When dampness causes illness, there may be many symptoms of turbidity and contamination, such as a dirty-looking face, cloudy discharge from the eyes, diarrhea with feces containing mucus or bloody pus, cloudy urine, profuse vaginal discharge in women, and weeping eczema. Dampness is glutinous and viscous. These properties are manifested in two ways. First, the fluids of secretions and excreta are viscous. Second, illnesses caused by the dampness evil tend to persist and be difficult to eradicate, and they often recur. Examples include rheumatism and eczema. Dampness tends to move downward and readily attack the yin sides of the body. It belongs to the water element, and the water element tends to move downward. Thus, illnesses caused by dampness tend to cause symptoms mainly affecting the lower parts of the body. For example, edema is generally more conspicuous in the lower limbs. Also, cloudy urine, vaginal discharge, and mucoid diarrhea are mostly due to the descent of the dampness evil. Thank you very much for your attention.